Okay, today we will be seeing about introduction to dental materials. Coming to the science of dental materials, it is defined as the study of composition and properties of dental materials and the manner in which they interact with the environment they are placed. Science of dental materials is a basic science which deals with physical, mechanical, and biological properties of dental materials. The study of science of dental materials gives the operator a basic knowledge about materials. This helps to choose a better material and allow for using it effectively and for manipulating. Coming to the question, why are we studying this field? Mainly, it is for the knowledge to make optimal selection of materials, to understand the behavior of materials, their use, handling, and manipulation, safety consideration of the materials, patient education regarding dental restoration materials, and recognition of materials which we will use in prostho or orthodontic or endodontic purposes. Coming to the and also understanding of professional literature about materials. Coming to the history of dental materials, it goes as far as 500 BC until present. So when it comes to metals like gold were used for dental purposes, and also plaster and wax models were used, and prosthetics of bone, ivory, wax, and metals were used, and porcelain came into existence in late 1700s, and amalgam came into usage in early 1800s, and acrylics came into usage in 1940s, and from 1970s, other dentistry is present. So we see the ancient Egyptian bridge, which was constructed and which was seen in fossil findings. Gold wire has been used to hold pontics of the crowns. Coming to oral environment, these dental materials are very demanding. There can be temperature variations in oral environment. There can be pH variations and also variations due to masticatory forces. Coming to temperature variations, normal temperature of oral cavity is 32 degrees Celsius to 37 degrees Celsius. On intake of cold or cold or hot food or any cold any drink which is very cold or very hot, the temperature ranges may be from 0 degree to 70 degrees Celsius. Coming to pH variations, the pH of saliva is usually neutral, which is 7. And on intake of acidic fruit juices or alkaline medicaments, pH may vary from 2 to 11. Coming to variation in masticatory forces, muscles of mastication apply forces to the dentition. The masticatory forces vary from tooth to tooth. Average force applied by the teeth increases from anterior to posterior. So in second molar, it gives an average force of 800 Newton. If it is first molar, it gives an average force of 390 Newton. If it is bicuspid, it may give an average force of 288 Newton. Coming to the characteristics of ideal material should be biocompatible, which is non-toxic, non-irritating, and non-allergenic. And it should be mechanically stable and durable so that it is strong and resistant to fracture. And it should be resistant to corrosion so that it does not deteriorate over time, and it should be dimensionally stable so that little change by temperature is received, and also it should have minimal conduction so that insulation against thermal and electric charge is present, and it should be aesthetic so that it looks like oral tissue, natural oral tissue, and it should be easy to manipulate. It should have minimal or reasonable effect, and if time needed, and it should adhere to the tissues, that is the tissue with which it retains to or seals. It should be tasteless and odorless. It means it should be non-pleasant. It should not be unpleasant to patient, and it should be cleanable and repairable so that it can be easily maintained or fixed, and it should be cost effective so that it will be affordable. Coming to the classification of dental materials fall under four main categories, that is polymers, metals, ceramics, and composites. Coming to polymers are chemical compounds consisting of large organic molecules formed by the union of many smaller monomer units so that it forms a polymer. And chemical reaction in which low molecular weight monomers are converted into high molecular weight polymer chains is called polymerization. Coming to the metals, an opaque lustrous chemical substance that is a good conductor of heat and electricity, and when polished it will be a good reflector of light. Coming to ceramics, ceramics are an inorganic compound with non-metallic properties typically composed of metallic and non-metallic elements. Coming to composites, composite materials, which are also called as composite materials or shortened to composites, are materials made from two or more constituent materials with significantly different physical or chemical properties that, when combined, produces a material with characteristic different from the individual components. Coming to the classification of dental materials can be classified as preventive dental materials and restorative dental materials and auxiliary dental materials. Among the restorative dental materials, there is direct restorative dental materials and indirect restorative dental materials. Among the preventive dental materials, the basic aim is to provide resistance to the progression of an active carious lesion. Carious lesion cause the demineralization of the dental enamel. These include chemotherapeutic agents like dentifrices, mouthwashes and cavity varnishes, pit and fissure sealants, fluoride releasing cements. So preventive dental materials can also serve as restorative materials. It can either be short time periods or moderately long time periods or longest time periods. Coming to restorative dental materials, it helps to repair or replace defective tooth structure. These may include amalgam, bonding agents, resin-based composites, compomers, ceramics, liners, cement bases, and dental polymers. Coming to the direct restorative materials, it will be used intraorally. It will be used to fabricate restorations or prosthetic devices directly on the teeth or tissues. Coming to the indirect restorative materials, it is used extraorally. It is formed indirectly over a cast in laboratory. Coming to the auxiliary dental materials, these are materials used in the process of fabricating dental processes. These may include impression materials, dental waxes, gypsum casts and model materials, finishing and polishing abrasives, acrylic resins for impressions, and acid etching solution. Coming to the temporary restorative dental materials, subcategory of restorative materials are these temporary restorative dental materials. It is intended to be used to restore the tooth temporarily. These may include orthodontic wires, cements which are used as temporary liners, cements which are used as temporary filling materials, and acrylic resins used for inlays, crowns, and fixed partial dentures. Coming to the selection of dental materials, it includes analysis of the problem, consideration of the requirements, consideration of the available materials and their properties, and the choice of a suitable material. Coming to the analysis of problem, it includes it is the most basic and very important step. Incorrect analysis may lead to wrong treatment plan, poor prognosis and failure of the treatment. So selection of filling material is very important. Coming to the consideration of the requirements, enlist the requirements that a material must meet. Requirements of a material are dependent upon each situation. Coming to the consideration of available materials and their properties, clear concept about properties, and in case of immediate problem, we must choose from the materials in hand which are available with us. The dentist must be up to date with the advancement in dental materials. Coming to the choice of a suitable material, it is the final step. It is a narrowing the range of choice. The factors that play a major role in choice of suitable material are availability, ease of handling, and cost effectiveness. Coming to the identification of restorations, a dental restoration restores function and appearance of oral structures lost by pathology, injury, or is congenitally missing. Example, in case of pathology, it may be a caries in which filling will be placed to restore the caries tooth structure. In case of injury, the broken teeth will be replaced by a crown. And in case of congenitally missing teeth, the prosthetics, example, implants can be placed. So coming to the identification of restoration, as a direct restoration, a restoration that is created and placed directly into the preparation site of the tooth, example, amalgam filling or composite restoration. Coming to indirect restoration, a restoration that is created outside of the mouth on a model of the prepared tooth and later fixed to the mouth, example, gold crown or dentures. Coming to direct fillings, it is usually made of amalgam or composite materials. For it is in case of dental caries of various degrees, both in anterior and posterior teeth. Coming to crown restorations, it is indirect restoration to replace the missing crown of the tooth or protect the remaining crown structure of the tooth. It, in case of caries or fractures teeth, which may involve RCT, in order to both replace the tooth structure lost and also for the aesthetics, we place crowns. It's made usually of metals or zirconia. Coming to the bridges, an indirect restoration to replace one or more missing teeth is called bridge. It is fixed and it is not removable. It is similar to the existing group of teeth. It is made of porcelain metals or both of them. Abutment is the tooth, the existing tooth that supports the bridge, and pontic is the replacement of the tooth. So here we see pontic and the abutment. Coming to the bridge, anterior bridge, we see an anterior bridge on the model before cementation and on the model. So this is before treatment, and after bridge cementation we see the model. Coming to indirect restorations, inlay, and a fabricated restoration made of metal or porcelain that replaces missing tooth structure and does not include the restoration of any cusp is called inlay. And onlay is a fabricated restoration which does include the restoration of the cusp. So in inlays we use porcelain inlays, and in case of onlay we use gold onlay. Coming to the veneers, all porcelain or acrylic facing for tooth, and primarily it is used for aesthetic reasons, and it can alter the shape and color of the existing teeth. Coming to dentures, the removable dental prosthetic used to replace all of the teeth in an arch is in which the patient is edentulous. It may be made of acrylic, whereas teeth may be made of porcelain. A partial denture is the one that replaces some teeth in the arch. Patients who are partially edentulous, it is made of acrylic usually, which are supported by clasps. So here we see full upper and lower denture, and here we see removable partial denture with the metal clasp for retention. Coming to endodontic restoration, the term endo means inside, and in case of root canal treatment, we use gutta percha material to fill the root canal, and we may use post and core. The post is a metal piece that is screwed into and cemented into the root, where there is more than 50% of the tooth structure loss. The core is built up around the post, and so that we can create a abutment. So here we see the post, the core is built on the post, and gutta percha is seen lower point. So these are the endodontic restorations where uh, we can see that in the radiograph posts and gutta percha and core builder. Coming to pediatric restorations, stainless steel crowns are usually used for pediatric patients. These are prefabricated and cemented onto the tooth. And in pediatric patients, we also use space maintainer, where after premature loss of the deciduous tooth, it holds the space maintainers holds the space where the primary tooth was prematurely lost, and stainless steel band and crown with loop can be used. It is fabricated. It is fabricated indirectly and placed into the mouth. Thank you.